For many patients, opioid-based pain management never becomes a problem, but opioids are strong medications and are highly addictive, so it's possible that a percentage of patients you prescribe opioids to will develop an opioid use disorder, known as OUD. In this video, we're going to go over some of the more common OUD symptoms we've seen in patients and how to handle these situations. There are 3 types of signs that a patient is dealing with an OUD: struggling with their prescription, increasing requests for opioids, and dangerous opioid-related behavior. First, let's look at the signs a patient is struggling. A patient may mention that opioids are constantly on their mind. They may describe trying to follow instructions and dosages, but finding themselves unable to do so. And finally, patients may insist that opioids are the only viable solutions, dismissing any non-opioid treatment options. Next, signs that show a patient's rising need. A patient demonstrating rising need may try to get more medication, saying that their pills were lost, stolen, or that they were not given enough. Patients may ask for greater and greater dosages. And finally, patients may become upset and threaten to seek out opioids elsewhere if they aren't given what they want. Finally, we look out for patients exhibiting dangerous behaviors. This can look like using opioids in dangerous situations, like while driving or consuming alcohol. They may mention personal problems, such as arguments about opioids with a spouse, family member, or close friend. Patients may mention falling behind at work or school because of opioids. And finally, patients who report any kind of oversedation or overdose. Diagnosing opioid use disorder can be tricky. If you notice any of these warning signs, it's important to keep asking questions so you can fully evaluate your patient's risk. Patients exhibiting any 4 or more of these symptoms are more likely to have moderate to severe OUD. If you feel your patients are at this stage, it may be necessary to offer them a specialty care treatment referral. And if someone is struggling with long-term use or addiction, they may need a referral for medication-assisted treatment. Try to explain to them what your worries are and why the specialist may be able to help. Remind them that having difficulty with opioids can happen to anyone, but that it's extremely important for them to get the help they need. To find addiction specialists nearby, visit the website